Before heading to the hospital for surgery, prepare your home for your arrival post-op. Remove rugs and furniture to make for a clear walkway. You will need a comfortable chair with sturdy arms to help you get up. A stool will help with leg elevation after surgery, and you may need to get an elevated toilet seat as well. We'll talk more about those exercises in just a little while, but first we want to take you through the joint replacement surgery process. Now that you and your doctor have decided joint replacement surgery is right for you, here's what you can expect. You will be given an appointment by the physician's office for pre-testing. Please allow about 2 hours of your time for this visit to the hospital. The appointment will be made for approximately 2 weeks prior to your surgery date. On the date of this appointment, you will arrive at the hospital and go directly to the main information desk at the entrance of the hospital. Once you're registered, you will be sent to the pre-testing area located off of the main lobby in the hospital. Here, a nurse will perform basic tests in preparation for your surgery. Please bring with you to this visit a written list of past surgeries, a list of allergies and how you react to each one, and a list of any medications and dosages you normally take at home. Remember to include any herbals, vitamins, or any other over-the-counter medications that you take on a regular basis. If you have recently seen your medical doctor, be prepared to discuss any medical testing that was done, including the dates and the results of the testing. You should also bring with you at this time a copy of your living will and health care power of attorney if you have either one. Also in pre-testing, you will have the opportunity to talk to your anesthesiologist about your anesthesia plan. A general anesthetic will put you to sleep, while a regional anesthetic numbs you from the waist down. You will also meet with your physical therapist on this day. The therapist will discuss with you your care that you will receive while you're in the hospital. It will be necessary for you to return to the hospital again for lab tests within 5 days of your surgery date. The pre-testing nurse will set you up during this visit. A nurse will call you the day before your surgery to go over last-minute instructions and to let you know what time to arrive for your surgery. You will be instructed what to bring to the hospital and what medications to take. Please leave jewelry, credit cards, keys, and checkbooks at home. This nurse can answer any last-minute questions that you may have. On the day of your surgery, please arrive 2 hours before your scheduled time. You will go directly to the surgical information desk in the hospital's atrium area and sign in. From here, you will be taken to the same-day surgery area. It's there that a nurse will perform a final pre-surgery assessment of vital signs and general health. There will be several checks to make sure the correct joint is being replaced. Your surgeon will review your x-rays and mark the area which will be operated on. Nursing staff will check the consent form you signed to make sure it agrees with the procedure on the operating room list. The nurse will start your IV for administration of fluids and antibiotic and apply wraps to your feet or legs. Next, the anesthesiologist will administer your pain block. After all of this is completed, your family will be called back to join you. From there, you will be taken into an operating room for surgery where your prosthesis will be implanted. Many people will be with you in the operating room during your surgery. The surgery itself can take between 2 and 4 hours depending on the complexity of your particular case. From the operating room, you will be taken to the post-anesthesia care unit where nurses will closely monitor your recovery. You can expect to be in this area for 1.5 to 2 hours. Here, the nurse will be taking your vital signs and you will have a mask over your face for oxygen. The nurse will frequently ask you to rate your pain. You will find that a large dressing has been applied to the surgical area to maintain cleanliness. You may have compression stockings wrapped around your feet or legs connected to a machine that blows them up with air to promote blood flow and decrease the possibility of blood clots. If you have had a hip replacement, you will notice a V-shaped wedge has been placed between your legs. This keeps your new hip in the best position while you are in bed. Now that the surgery is complete, you will be transported to your suite on Weirton Medical Center's 7th floor Joint Care Center. That's where our staff will make every effort to minimize your pain and to keep you comfortable. Be prepared to stay in the hospital for 3 to 5 days after your surgery. You may require additional aid through a home health agency upon discharge, while others may need to continue their recovery in a rehabilitation facility. Our staff will monitor your blood pressure, your pulse, respiration, temperature, and circulation. You will have a catheter in your bladder, which will be removed 1 day after surgery. You will also have a pain pump and ice through an ice machine on the affected areas. Knee patients, you will be attached to a machine to passively bend and straighten your leg. Keep in mind, a drain may be placed in your joint in order to remove fluid. Now to those exercises. Not only will you be exercising your newly replaced joint, but your lungs as well, which is critical to your recovery. A physical therapist or a nurse will come right to your room to instruct you in your exercise program, to help you out of bed and begin walking using a walker. Remember to do the exercises slowly and remember to breathe. The exercises may cause pain, so we advise you to request your medication 30 minutes prior to exercising. Do these exercises before your surgery, during your hospital stay, and when you return home. Repetition will strengthen your muscles. If you have any questions, please ask your physical therapist or your orthopedic surgeon. Remember to perform all exercises 3 to 4 times a day. All right, let's get started. First, we're going to do ankle pumps for hip and knee replacements. You want to bend and straighten the ankles. Do 20 reps 4 to 5 times a day. The motion is like pressing on a gas pedal. This will increase circulation and decrease risk of blood clots. Pause the video here so you can do 20 reps of the ankle pump. Now on to quad sets for knee and hip replacement patients. Lie on your back with your legs straight. Tighten your thigh muscles for 5 seconds and press the back of your knee right into the bed. Repeat 20 repetitions. Remember to breathe. Pause your video here so you can complete 20 quad sets. Now to the heel slide for knee and hip patients. Lie on your back with your legs straight. Slide your heel toward your buttocks and slowly return to the starting position. Keep knees and toes pointed upward. And remember, don't let your leg drop. Pause the video here now to complete 20 heel slides. Hip and knee patients will both need to do this next exercise. It's called the hip abduction. On this, you want to lie on your back, keep your toes and knee pointed upward, and slide your leg to the edge of the bed and back to the starting position. Pause the video here and repeat this 20 times. Now to the straight leg raise. For these, you lie on your back with one leg straight and the other leg bent. Lift your straight leg up in the air. Keep your leg very stiff and straight through the whole movement, raising and lowering very slowly. Pause your video here to repeat the straight leg raise 20 times. Now the following 2 exercises are for knee replacement patients only, so hip patients, you want to skip these next 2 exercises. Okay, to the short arc quad. These are for knee replacement patients again. Knee patients, place your pillow under your knee while keeping your opposite leg straight. Straighten your knee while tightening your thigh muscle. Pause the video here and repeat the short arc quad 20 times. Now to the long arc quad. Again, this one is for knee replacement patients only. For this one, knee patients will sit in a chair and raise their legs straight off the ground. Hold it there for 5 seconds and then relax. Pause the video here and repeat 20 times. Now to gluteal sets. This is for hip replacement patients only. Knee replacement patients can fast forward to our next section. Hip patients, here we go. For gluteal sets, we want you to lie on your back, tighten your buttocks, squeeze your hips together, and hold for 5 seconds. Then relax. Breathe so you don't increase your heart's workload. Pause the video here so you can complete 20 reps of the gluteal sets. With the help of your physical therapist and a walker, your exercise routine will include walking and stair climbing. The goal of therapy is less pain and better joint function. You should have 0 to 115 degrees of motion in your knee 3 weeks after surgery. Remember to walk at a normal pace, look in the mirror, or have someone tell you if you are walking straight. Your recovery depends on how you follow your rehab plan. Remember, keep your wound clean and dry. You can shower when you're strong enough and the wound is healed. It's common to have pain and stiffness after surgery, and remember to be careful going up and down stairs. Remember to ice your knee intermittently after exercising at home. You can elevate your knee as well. As you and your doctor have discussed, there are risks with joint replacement surgery. Risks such as infection, bleeding, blood clots, urinary tract infection, pneumonia, and dislocation. Call your surgeon if you have the following symptoms: increased calf pain or swelling or tenderness, redness, chest pain, shortness of breath, or coughing. Report any symptoms of infection to your surgeon, including persistent fever, shaking or chills, swelling of the wound, drainage of the wound, or increased knee pain. Hip patients, do not cross your legs, do not bend greater than 90 degrees, and do not turn your leg inward or outward. Place a pillow between your legs at night. And watch for the following signs of dislocation: shortening of leg, leg pointing inward, or sudden groin pain. As for driving, you can get back behind the wheel of a car in 4 to 6 weeks. Remember, a well-balanced diet with an iron supplement can help with your recovery. Make sure you continue to exercise at home, gradually increasing the amount. Exercise is key to your recovery.